My practicum focused mostly on collaboration and engagement in the town of Cochrane. Sorry if I get really loud. I get loud when I'm nervous. Quick territory acknowledgement. I am a humble guest that lives and works in Alberta, and it's on the traditional territories of the Îyârhe Nakoda, Tsuut'ina, Northwestern Métis Region 3, and the Siksika-Tsitapi Confederacy. And today I am excited to present as a guest on the traditional land of the Songhees, Esquimalt, and Wasatch people. So I got to work on a project called CLEAR. CLEAR is a community-led elder abuse response. In Alberta, it is a publicly funded grant to create what are called coordinated community response models. They are targeted to reduce elder abuse in communities. And the goal of this particular project was to bring stakeholders together as a collaboration to share their knowledge and their resources in order to reduce elder abuse in the community itself. My role within the practicum was to collect information through stakeholder engagement, facilitating discussions with other CCR models working in the province, and to create presentations with that information, as well as create the terms of reference for this collaborative discussion table. My practice scenario was to find out more information for how we can better support the Indigenous population in the community. I was able to get in contact with the tribal chief ventures in Treaty 6, as well as Eagle's Nest in Morley, which is a women's shelter, and the Indigenous outreach program that is currently being run through Victim Services in the town of Cochrane. And I use this to try and create a model or a care plan of how best Cochrane can move forward in a more, in creating an Indigenous perspective to their elder abuse care model. The skills that I utilized, I used a lot of this BA program, mostly in inquiry and analysis and the interprofessional teamwork. I was able to gather a lot of information through discussions and literary research, and use my interprofessional skills to help create their terms of reference. Oh, Jesus. Sorry. One of the things that I was able to do when I first arrived at Cochrane is that I reviewed their current practicing model for healthcare professionals on how to be aware of elder abuse in their communities and how to educate them and advocate for those clients that might be experiencing abuse. And one thing I noticed is that they were lacking a territory acknowledgement. And when addressing that, they were actually able to add it to their current working document. The knowledge areas that I chose to focus on were determinants of health and health inequalities, how to improve health and reduce health inequities, and develop knowledge and skills required to work effectively. I used a lot of interprofessional practice skills and active listening to try and create a very open and non-judgmental space to allow those conversations to happen and to build relationships, as well as learn new perspectives around elder abuse happening in the community and how each stakeholder attacks the challenge. I then took all of that information and tried to accurately reflect it into their terms of reference that they're currently using. And it all came about by recognizing that there wasn't an Indigenous perspective to this document, and then also trying to get them to be more aware and to kind of look at it through a different lens as well when talking to each of the stakeholders. The values that I focused on was collaborative action, community-based approaches, and partnerships with people. It was a very big collaborative team. We have stakeholders through all sectors, whether it's criminal justice, social services, even financial institutions. Financial abuse is one of the leading causes of elder abuse in Canada as well as Alberta. And by engaging with these people, I was able to create a very well-structured document that they are currently using. Sorry, I'm running out of time. The call to action that I definitely used or thought about the most was advocating and supporting Indigenous education awareness programs. Town of Cochrane is actually running an education and awareness program currently. And by having more of these programs, my hope is that we would also be able to make it easier to advocate for funding, and because the understanding would be there as to why we need more Indigenous-led elder abuse programs. This was a fantastic opportunity. I really was impressed with the foundation of knowledge that I received just by the different perspectives of the different students, as well as learning from the ladies at the Cochrane Resource Center themselves. Oh, thank you. Sorry, I am out of time.
Excellent, thank you. What a fascinating practicum. Who's got questions?
It's fine if you have lots. I know I was scared.
Can you say a little bit more about the issue? Anything about what we know about the prevalence of elder abuse in Indigenous communities?
It's definitely there. It's definitely a struggle to create a conversation with. When I got to know Dale Steinhauer, who works with Treaty 6, they had already started creating a community response model with Treaty 6 surrounding elder abuse, and they actually, when doing the presentation stage of the collaboration, came up with quite a few setbacks. It was a lot of shame that was involved, and it was really a lot of tension that was created within the community, and some of the communities out of the 6 nations that they represent refused to even want to be a part of it. So we really had to take a big step back and focus on relationship building before we could actually build that trust and move forward.
Did they use any form of community readiness model when they were doing
They
that?
did, yeah, they definitely did, but they had been approached previously by, I think it was Alberta Health Services a few years earlier, and it wasn't a very well thought out program and presentation, and it did not get received very well. So they had to really take a few steps back and reestablish some trust in the communities, which is what we are currently working on in the town of Cochrane. So
excellent.
Yeah.
Thank you. Any other questions, comments? Oh, there we go. Oh, was there one over there first?
Let's do this side of the room first. Yeah, so I think it sounds like a really cool program. I was wondering if you could comment on maybe some of the types of abuse that are the most prevalent that you guys are trying to deal with, because I know there's a wide variety of types of abuse and the approaches would be very different.
Absolutely. And financial abuse was definitely one of the bigger ones that we realized we weren't representing in the collaborative table. So currently we have RCMP, Victim Services, Mental Health, Home Care, and the Resource Center all present working together, but we realized that the financial institutions weren't actually being engaged, but they do have elder abuse protocols in place in Cochrane themselves that they took the initiative on. So we really focused a lot on, it's a lot of familial abuse. Generally it comes from the child themselves or the grandchild or caregivers. So that's why home care and mental health are definitely a huge partner in our collaborative table, is because we definitely want to reduce the amount. There's a lot of legislation around caregiver abuse. There's nothing currently in Alberta for familial abuse, protecting seniors. So we are trying to develop programs to protect seniors where the legislation hasn't come into place yet.
Thank you. There was another question over here.
Hi, great presentation. When you were looking into everything to establish like better supports for elder abuse, did elder suicide come up at all?
It does in a way. A lot of it was self-neglect, and self-harming kind of went hand in hand. When we see, especially in a rural environment like Cochrane, we have a lot of social isolation and a lot of self-neglect that starts to happen when there are no resources and there's nobody around to actually check in on those people and check in on those patients. So it's, we have suicide preventions in place as a broad population, but not as an elder abuse specific format. And actually from this project, when we got all the information together, we realized that all of us were engaged with much more than just elder abuse themselves when it came to aging population care. So we've actually expanded the project to include complex care or overwhelming health status and possible self-neglect and self-suicide issues. So, yeah.
Thank you so much, Jenna. Is there anything else? Otherwise, I think we'll say thank you and move on to the next presentation. Thanks so much. You're done. Yay.